Good morning. We begin our program this morning talking about some of the moves being made by the Trump administration, how they could impact your health care. John Driscoll is the chairman of UConn Health and healthcare advisor to Governor Lamont. He joins me in Studio A. Welcome.
Delighted to be here.
This is, I feel like I started many interviews this way in these days. Things are rapidly changing as far as what's happening between Washington and Connecticut on a number of fronts. Healthcare for sure is one of them. So before we even get into the nuts and bolts and how it affects the average guy at home, is this a time where every day you're trying to process new information coming at you?
Well, there's no question that with executive orders coming by the day, and some of them affecting the essential healthcare access and cost problems that affect everyday Connecticut residents, that we have to kind of look at each day anew. But there are some big themes here that I think we all have to pay attention to. Tariffs and changes in policy and cuts to some essential healthcare programs like Medicaid that threaten access for residents throughout the state.
Well, let's do them in the order you just mentioned them. Drug prices is something that could be affected by tariffs. Is that the big one where tariffs play a role in healthcare?
Tariffs, the threat of tariffs, the chaotic way it's been implemented, really is probably the biggest thing that's going to affect the average consumer. The first thing to think about is by putting tariffs and threatening the supply chain from India and China, you're really threatening the supply chain of all the prescription drugs that people take. So in addition, tariffs being cost increases on drugs. And look, people today are having a hard time making do with increasing drug prices. It runs the risk of actually challenges in supply. There are already 200 drugs that are on limited supply or at risk of being basically shut out of access for hospitals and doctors. This is not a time to increase prices on drugs or potentially threaten the supply chain.
So how quick does it affect people, say at UConn Health? Are these things you're already seeing the actual dollars and cents impact?
You won't see it immediately. What'll happen is as those tariffs hit and the 100+% increases, they will start to roll through probably in the next 60 to 90 days. But let's start with the fact that drugs already cost too much. Specialty drug prices are through the roof, and there are already pharmacies shutting down. Just recently, I got a notification on a pharmacy shutdown in Stamford this morning. We've got real challenges today, and by tariffing things, which are really cost increases, to subsidize tax cuts for the wealthy, potentially, cutting Medicaid, you're basically starting to cut at not just the fat, but the muscle and the bone of the healthcare system.
So the idea that, where tariffs are taxes and that's being used by the Trump administration for a tax cut on the wealthy, that's for sure a Democratic talking point. And when you look at it from a healthcare executive standpoint, if somebody says to you, but John, listen, I want Trump. I like this. I'm willing to give him the time. Do you have a message for those people? Because a lot of our viewers heard you say that, and wherever else they get their news here and other places, said he just said a Democratic talking point.
Well, I think Trump actually has a very important point in that he wants to see manufacturing of essential pharmaceuticals, prescription drugs, move more domestically. I think everyone agrees with that. The way it's being implemented, though, chaotically, quickly, too fast for the supply chain to support it. As a healthcare executive, as someone who was president of healthcare at Walgreens and was CEO of a Connecticut healthcare services company with nurses that go to the home, I can tell you as an executive, I love the idea of making more drugs in America, but let's make sure we have a plan to get there, and a plan that doesn't include cost increases for the average consumer.
Another thing that for sure is going to hit people in Connecticut and patients at UConn Health for sure is Medicaid changes, cuts. What are you seeing and what are you bracing for?
Well, I think we don't really know the scope of it. And we're tightening our belts and figuring out how we can lower the cost of doing business so that we can continue to provide the essential care that we have as a state mandate, as a state hospital. And Medicaid, we're not going to walk away from Medicaid. But I think what's hard right now is to figure out how deep it's going to go. Medicaid, 1 out of every 2 babies in America is born on Medicaid. It covers 30 to 50% of all kids. These are really essential programs. And so I think the first thing we're trying to do is to make sure that the people making those decisions in D.C. understand the downstream cuts. But as to what we're doing right now, we're going to become more efficient and more effective at doing what we do.
We heard it from state legislators that it's hard for them to do the next budget for the state because there's so many uncertainties. How do you deal with budgeting when you're looking at, you don't know what's coming in, right?
Well, at UConn, we've got the benefit of we're the fastest growing health system in the state. We've got more demand than supply. And we're in the process of getting our commercial contracts in the right place so that the insurers are paying fairly for the services we are providing. So it's making sure our revenues are up and our cost of doing business is down. Our mandate from the governor is to get to the point where we can start contributing back to the university and the state and not just be depending on the state for subsidies. So we're heads down, trying to become more efficient and get better rates from insurance companies.
As I talk to experts, I always try to think about the people with the remote controls at home who are watching this, and it's clear from hearing you talk that you're an incredible expert on this. But if somebody at home is saying, John, you know all this stuff, you deal with it every day, what should I be looking out for? Do you have any advice? Are there any milestones that you're going to be watching as we continue to kind of feel out what's happening with the Trump administration over the next 30 or 60 days? We got about a minute left, but what would you tell people to watch for?
I think what you've got to look for is where the policy actually settles. Because whether you're a Democrat or a Republican, the policy's been moving around really fast. And to make sure that you're talking to your elected representatives about what matters to you. Drug prices, we have to find a way to lower those drug prices, and that's a Democrat as well as a Republican talking point. But making sure that if you care about care in your community, you're standing up for Medicaid, because there are as many Republicans covered by Medicaid as there are Democrats.
No, it is certainly an interesting time in so many fields, but healthcare for sure is one of them. And as you say, we're going to have to see where everything settles because there are a lot of things on both sides being said right now. John Driscoll, we very much appreciate you being here with us, and hopefully we'll have you back here again on the show soon.
Delighted to be here.
Thanks.